In this video, we are going to see about the median nerve in detail. So the overview of the nerve supply to the upper limb, it is basically by brachial plexus. So the distribution of main nerves that are concerned with the upper limb are the axillary nerve, which is supplying the deltoid and teres minor, musculocutaneous nerve, which supplies the flexor compartment of the arm, median nerve, which supplies the flexor compartment of the forearm, and few of the intrinsic muscles which are on the lateral half of the hand. And since the flexor muscles of the forearm perform the actions against the gravity, this nerve is termed as laborer's nerve. Next is the ulnar nerve, which supplies the flexor compartment muscles of the forearm on the medial side and most of the intrinsic muscles of the hand, which are mainly for prehensile movements like writing, drawing, playing an instrument. So this ulnar nerve is called as musician's nerve because it is concerned with very fine intricate movements of the hand. And next is the radial nerve, which innervates the extensor compartment of the arm as well as the forearm. So here in this video we are going to see the median nerve in detail. So this median nerve is cutaneous to the flexor surfaces here of the hand and nail beds of 3.5 fingers of the radial side and a part of the radial half of the area in the palm. And this is called as laborer's nerve, as I have said that the hard movements and the against the gravity movements like digging of the ground, lifting the weight are carried out by the flexor muscles of the forearm, which is supplied by the median nerve, so is called as laborer's nerve. This nerve also is called as eye of the hand or peripheral eye because the innervation of the pulp of thumb and index finger, which are used to see without seeing the structures like the texture of the cloth or holding something and naming that object, differentiating the different objects without seeing. That is the reason this median nerve is termed as the eye of the hand or peripheral eye, and is also doing fine movements like buttoning up the coat, needling and sewing with a needle. So all these things are done by holding the object with thumb and index finger. So and these buttoning of the coat and all are done with the radial 3.5 fingers movements. So that is the reason it is called as the peripheral eye. So this is what is the median nerve, which here in the forearm it supplies most of the lateral part of the muscle, the deep muscle, and most of the flexors of the forearm are supplied by the median nerve, and the lateral or the radial side of the hand also has its supply from the median nerve. So this median nerve gives muscular branches, as we have said, to all these muscles which it is supplying in the forearm and in the hand, and then it gives articular branches to the elbow joint, to the superior radio-ulnar joint, inferior radio-ulnar joint, and wrist joint. As it passes across all these joints, it gives a twig, the articular twig to all these joints. And it gives vascular branches to the brachial artery in the arm and the ulnar and radial arteries and the forearm, and also to the anterior interosseous artery, the anterior interosseous branch of the median nerve. It gives its vascular twigs to that. And coming to the motor functions, it is responsible for thumb flexion, opposition of the thumb, and flexion of digits 2 and 3, that is the index finger and the middle finger, wrist flexion, abduction, and forearm abduction and pronation as well. And it is sensory to the skin over the anterolateral surface of the hand, this one, and to the 3.5 fingers on the radial side. Here you can very clearly see, which is depicted in this yellow color. 3.5 fingers of the lateral aspect, and also the 3.5 fingers on the dorsal aspect of the hand up till the middle phalanx. We'll see in detail how they are all supplied. So this is what is the median nerve, which is on the anterior compartment, anterior aspect of the forearm, which passes from the axilla and then into the arm and then into the forearm and in the hand. And this median nerve has its supply in the forearm and hand. So here in the flexor compartment of the arm, the supply is by the musculocutaneous nerve. Coming to its root value. So the root value of the median nerve is the ventral branches of ventral rami of C5, 6, 7, 8 and T1. It has its fibers coming from all the roots that are forming the brachial plexus, because if we see the formation, we will come to know why is it so. So this median nerve is formed in the axilla, here you can see, by the union of the medial and the lateral roots of the median nerve. So the medial root of the median nerve is derived from the medial cord, and the lateral root of the median nerve is derived from the lateral cord, and they join in front of the third part of the axillary artery to form the median nerve. The lateral root of the median nerve being the continuation of the lateral cord of the brachial plexus, carrying C5, C6 and C7. The medial root of the median nerve carries its fibers from C8 and T1. This can be said by seeing the roots here. This is what is the root value. So the C5, C6, C7, C8 and T1 are the roots that are forming the brachial plexus. So these roots, the C5, C6, they join to form the upper trunk. C7 continues as middle, C8, T1 as inferior trunk, and which gives rise to ventral and dorsal divisions, all the trunks. So the ventral division of upper and the middle trunks, they join to form the lateral cord. The ventral division of the lower trunk continues as medial cord, and the dorsal divisions of all the three trunks join to form the posterior cord. Since the lateral cord is formed by joining the upper and middle trunks, which carry C5, 6 and 7 root fibers, and the medial cord, it carries the fibers from C8 and T1. Since the lateral root of the median nerve is a branch from the lateral cord, the lateral root has its root value as C5, C6, C7 as it carries fibers from these three roots. And the median root of the median nerve also is carrying C8 and T1, which becomes its root value. Here, a point to be noted is few fibers of C1 which are carried along the lateral root and then via the lateral root of the median nerve join with the ulnar nerve after passing behind the medial root and in front of the axillary artery. So this C7 fibers which are being carried by the lateral root and the lateral root of the median nerve as they are joining the ulnar nerve, they supply exclusively to the flexor carpi ulnaris muscle. So now coming to the course, we will see the course of the median nerve in the axilla and then in the arm, then in the cubital fossa, followed by its course in the forearm, then in the carpal tunnel here, and then at the end in the palm. So let us see it. Course of the median nerve in axilla. So this is the lateral cord and this is the medial cord which is between the axillary vein and the axillary artery. This is the lateral root of the median nerve which is the continuation of the lateral cord. This is the medial root of the median nerve, a branch from the medial cord. They join to form the median nerve in front of the axillary artery, that is the third part of the axillary artery in the axilla. After the formation of the median nerve runs lateral to the axillary artery. This is the teres major muscle, the lower border of which marks the demarcation between the axillary artery and the brachial artery. That is, from the lower border of the teres major, the axillary artery continues as the brachial artery. In the axilla, the median nerve gives no branches. This is the cadaveric dissection picture. This is the M-shaped structure of the median nerve, where the middle one, the V of the M, as we all know, are the lateral and the medial roots of the median nerve. They join to form the median nerve. So this is the musculocutaneous nerve. You can see it clearly piercing the coracobrachialis muscle. And this is the ulnar nerve, and this being the medial cutaneous nerve of the forearm. So here, this is the axillary artery. So the lateral root and the medial root of the median nerve, they join in front of the axillary artery and run lateral to the axillary artery after the formation of the median nerve. So the course of the median nerve in arm, that is, after it courses along the lateral aspect of the axillary artery from the lower border of the teres major, it also courses lateral to the proximal part of the brachial artery. And in the middle of the arm, where the coracobrachialis insertion also is seen, the median nerve at the middle of the arm, there are about 9 events that are occurring at the middle of the arm. So this is one of the event is the crossing of the median nerve from lateral aspect to the medial aspect in front of the brachial artery opposite the insertion of the coracobrachialis muscle, and it descends on the medial aspect of the brachial artery and then enters into the cubital fossa. Before it enters into the cubital fossa, that is at the distal end of the arm, the median nerve, it gives a muscular branch to the pronator teres muscle. So there's only one branch that is given in the arm. A nice thing to know here about the median nerve is in the distal part of the arm, there may be a presence of the projection anteromedially above the supracondylar ridge on the medial side, which is called as supracondylar spur. So a fibrous band may be attached to the supracondylar spur above, and below it blends with the common flexor origin of the muscles, or more so it blends with the pronator teres muscle at its origin. So there is all possibility of the median nerve along with the brachial artery to be compressed beneath the Struthers ligament. May get compressed or may not get compressed also. Even if supracondylar spur is not there, the Struthers ligament may be present. There is another thing to be known as the arcade of Struthers. So the Struthers ligament is way different from the arcade of Struthers anatomically. The arcade of Struthers is nothing but an eponeurotic structure, a sheet of eponeurotic structure which extends from medial intermuscular septum to the medial head of triceps. This arcade of Struthers may compress the ulnar nerve. The ligament of Struthers compresses the median nerve. So here it is diagrammatically represented because the median nerve, it courses along the medial side of the brachial artery because of the presence of the supracondylar process anteromedially. The both neurovascular structure, it passes beneath the supracondylar spur and the Struthers ligament to which it is attached. The median nerve and cubital fossa. So from the arm, as the median nerve descends down along the medial side of the brachial artery, it enters into the cubital fossa, being a content of the cubital fossa. This is the medial most structure that is present in the cubital fossa. Lateral to it is the brachial artery. More lateral to it is the tendon of biceps, and more lateral to it is the superficial branch of the radial nerve. These are the contents of the cubital fossa. So here in the cubital fossa, the median nerve along with the brachial artery, being medial to the brachial artery, it rests on the brachialis muscle, and the nerve leaves the cubital fossa through the gap between the superficial and deep heads of the pronator teres. That means the median nerve passes between the two heads. Here it is diagrammatically represented, you can see. It passes between the superficial head, that is the humeral head, and the ulnar head, which happens to be the deep head of the pronator teres. And the nerve crosses the lateral side of the ulnar artery and is separated by the deep head of the pronator teres. So at the level of neck of radius, the brachial artery will be dividing into its terminal branches, the radial artery and the ulnar artery. Ulnar artery goes along the ulnar side and the radial artery courses along the radial side of the forearm. So as this median nerve being medial to the brachial artery, it crosses the ulnar artery in front and courses along the lateral aspect of the ulnar artery. So the deep head of the pronator teres is between the median nerve and the ulnar artery. So if we see the structures that are related from above downwards, from the pronator teres onwards, it is the superficial head of the pronator teres, then it is the median nerve, it is the deep head of the pronator teres, and then is the ulnar artery. Course of median nerve and forearm. So from the cubital fossa, the median nerve enters into the forearm beneath the tendinous arch of the flexor digitorum superficialis, which is formed by the humero-ulnar head and the radial heads of the flexor digitorum superficialis. So here these are the superficial flexors of the forearm. This is the pronator teres. Then this is the flexor carpi radialis. This is the palmaris longus. So once these long flexors, that is the flexor carpi radialis and palmaris longus, are reflected, this big sheet of muscle, which is flexor digitorum superficialis, will be exposed. So here the median nerve, to enter into the forearm, it goes beneath this musculotendinous arch of the flexor digitorum superficialis. So here you can very clearly see this is the tendinous arch of the flexor digitorum superficialis, this being the humero-ulnar head and this being the radial head. So this is the median nerve. So that goes beneath this arch and rests on the flexor digitorum profundus. So when this flexor digitorum superficialis is reflected, the median nerve is seen plastered to the posterior surface of the flexor digitorum superficialis. In other words, in the forearm, the median nerve is between the flexor digitorum superficialis and flexor digitorum profundus. As it descends down in the forearm, it is accompanied by an artery, which is a branch of the anterior interosseous artery, by name arteria nervi mediana, which is regarded as the remnant of the axis artery of the upper limb. As it descends down at about 5 centimeters above the flexor retinaculum, from under cover of the lateral border of flexor digitorum superficialis, median nerve is seen superficial as it approaches the wrist. And at this juncture, about 4 centimeters from the flexor retinaculum, the median nerve gives a cutaneous branch by name the palmar cutaneous branch, which passes above the flexor retinaculum to supply the central part of the palm and the thenar eminence. So the skin, the cutaneous supply to the central part of the palm and the thenar eminence is by the palmar cutaneous branch, which arises above the flexor retinaculum and passes superficial to the flexor retinaculum. And here at the wrist, the median nerve is between the tendons, the long tendons of the flexor carpi radialis and the palmaris longus. These are the tendons which are reflected. Since these two long muscles are reflected, we are able to see this intermediate strata muscle, which is the flexor digitorum superficialis. So this is the place where just above the wrist, proximal to the wrist, the median nerve blocks can be given. A word about the anterior interosseous nerve, which is a larger branch from the main trunk of the median nerve, carrying fibers from C8 and T1 roots. As it descends down, it rests between the flexor pollicis longus and flexor digitorum profundus, resting over the interosseous membrane, accompanied by anterior interosseous artery, and this ends deep to the pronator quadratus, supplying that muscle. So this anterior interosseous nerve classically innervates the 2.5 muscles. So all the deep muscles of the arm are innervated by anterior interosseous nerve. So these 2.5 muscles are the flexor pollicis longus, the pronator quadratus, and the radial half of the flexor digitorum profundus, the tendons of which go and get inserted onto the terminal phalanx of index and middle fingers. So as it descends down here, you can see very clearly the anterior interosseous nerve is resting over the interosseous membrane, which courses between the flexor pollicis longus and the flexor digitorum profundus, accompanied by anterior interosseous artery. It also gives the articular branches to the inferior radio-ulnar joint, the wrist joint, and the carpal joints. There are no sensory branches that are given from the anterior interosseous nerve. Median nerve and carpal tunnel. So at the distal end of the forearm, the median nerve, which is resting between the flexor carpi radialis tendon and the palmaris longus tendon, enters into the carpal tunnel beneath the flexor retinaculum. This is the carpal tunnel, which is formed by the flexor retinaculum above, or in other words, the carpal tunnel is roofed by the flexor retinaculum, and the floor of the carpal tunnel is formed by the hamate bone, capitate bone, trapezium and trapezoid bones, the carpal bones. So this happens to be the carpal tunnel, which houses the four tendons of the flexor digitorum superficialis and the four tendons of flexor digitorum profundus wrapped within the ulnar bursa, and flexor pollicis longus also is seen wrapped within the radial bursa, above which is the median nerve. So as the median nerve enters into the palm through this carpal tunnel, the median nerve is present just beneath the flexor retinaculum and above the ulnar bursa. So this is what is the carpal tunnel and the median nerve relations in the carpal tunnel. So the median nerve has all possibilities of getting compressed within the carpal tunnel when there is fibrosis of the flexor retinaculum, or if there is any inflammation of the ulnar bursa, which decreases the space within the carpal tunnel, thus compressing the median nerve. And if the dislocation of the lunate carpal bone happens too, that decreases the space in the carpal tunnel, in turn compressing the median nerve. The compression of the median nerve within the carpal tunnel is known as carpal tunnel syndrome. So the median nerve in hand, before we go into the course of it, let us have the orientation of the structures that are present in the lateral half of the hand. So these are the thenar muscles forming the thenar eminence. So this is the abductor pollicis brevis. This muscle is the flexor pollicis brevis, the superficial head, beneath which is the deep head of the flexor pollicis brevis, which has its supply from the ulnar nerve also. So this flexor pollicis brevis is a dual nerve supply muscles. So if these two muscles are reflected, beneath this is the opponent's pollicis, and these are the long tendons of the flexor digitorum superficialis, and beneath this are the tendons of flexor digitorum profundus. So this is the first lumbrical and this is the second lumbrical, which arise from the tendons of the flexor digitorum profundus and get inserted onto the dorsal digital expansion on the dorsal aspect. As these lumbricals link the flexor tendons with the extensor tendons, these lumbricals are known as link muscles. In the hand, the median nerve gives 5 muscular branches and the cutaneous branches, which supply the lateral 3.5 fingers. So let us see the course of the median nerve here in the hand. After it passes from the carpal tunnel and appears at the distal border of the flexor retinaculum, the median nerve is divided into medial and lateral branches. The lateral branch of the median nerve gives a recurrent muscular branch. As soon as the median nerve is dividing into medial and lateral branch, the lateral branch gives a muscular branch which is called as a recurrent muscular branch, supplying the thenar muscles, which are the abductor pollicis brevis and the flexor pollicis brevis. Deeper to these two muscles is the opponent's pollicis. So it supplies all these three thenar muscles. The recurrent branch of the median nerve supplies these three thenar muscles. After the recurrent branch is given, the lateral branch then divides into three proper palmar digital nerves, which supply both the sides of the thumb and the radial side of the index finger. The proper palmar digital nerve, which supplies the radial side of the index finger, also supplies the first lumbrical. Here, this is a diagrammatic representation. This one. And now let us see the medial branch of the median nerve. The medial branch subdivides into two common palmar digital nerves, which are again lateral and medial. The lateral common palmar digital nerve divides into proper palmar digital nerves, supplying the adjacent sides of the index and middle fingers. Next, the medial common palmar digital nerve, before dividing into proper palmar digital nerves, it receives a communication branch from the superficial branch of the superficial branch of the ulnar nerve. So after receiving the communicating branch from the ulnar nerve, the median common palmar digital nerve then divides into proper palmar digital nerves, supplying the adjacent sides of the middle and the radial side of the ring finger. So this common palmar digital nerve, the medial common palmar digital nerve, that supplies the second lumbrical muscle. So these digital nerves, here you can very clearly see the proper palmar digital nerves. They supply the cutaneous sensations to the lateral 3.5 digits on the palmar aspect, and it also supplies the dorsal aspect of the 3.5 digits also, where the second and the third digit, that is the index and middle finger, they have their cutaneous supply on the dorsal aspect till the middle phalanx, whereas on the dorsal aspect of the thumb, the cutaneous supply is only till the terminal phalanx. So this is what is the cutaneous supply of the median nerve. This is the dorsal aspect. You can see clearly that these are the branches of the median nerve which also supply on the dorsal aspect till the middle phalanx. Coming to a very brief summary of the median nerve, this is formed by the lateral root and the medial root of the median nerve, which are from the lateral and medial cords. So it carries all the fibers from all the roots, that is from C5, 6, 7, 8 and T1. So the fibers from all these roots are carried along the median nerve. So in the axilla, the median nerve gives no branches and is related to the lateral side of the axillary artery. Then it enters into the arm, and in the proximal part of the arm, it is related to the lateral aspect of the brachial artery, and in the middle of the arm, opposite to the insertion of coracobrachialis, the median nerve crosses in front of the brachial artery from lateral to the medial side and descends along the medial side of the brachial artery. In the arm, it gives one branch which is to the pronator teres. At the elbow, the median nerve, being the content of the cubital fossa, resting on the brachialis muscle, medial to the brachial artery, and is related to the biceps tendon also more laterally, and is crossed by the bicipital aponeurosis and the cubital fossa, and it enters into the forearm between the two heads, that is the superficial and deep head of the pronator teres, and goes beneath the musculoeponeurotic arch of the flexor digitorum superficialis, resting over the flexor digitorum profundus, supplying all the superficial flexors, that is to the pronator teres, flexor carpi radialis, palmaris longus and flexor digitorum superficialis. In the upper part of the forearm, just distal to the pronator teres muscle, it gives a larger branch which is called as anterior interosseous nerve that supplies the deep muscles of the forearm, being flexor pollicis longus, pronator quadratus and radial half of the flexor digitorum profundus, which sends its tendons to the index and middle fingers. At the wrist, it becomes superficial, the median nerve, and is between the flexor carpi radialis and the palmaris longus. It becomes superficial beneath the lateral border of the flexor digitorum superficialis, and as it approaches the flexor retinaculum, the median nerve is between the flexor carpi radialis and the palmaris longus muscle, the tendons of these two muscles. At its superficial part, at the distal part of the forearm, it gives a cutaneous branch which is called as palmar cutaneous branch, which supply the skin over the center of the palm and the thenar eminence. So from the forearm, it enters into the hand beneath the flexor retinaculum through the carpal tunnel, where it supplies the thenar muscles and first and second lumbricals. So the thenar muscles are supplied by the recurrent branch of the median nerve, which are the abductor pollicis brevis, flexor pollicis brevis, and this flexor pollicis brevis deep head has its supply from the ulnar nerve also. So the flexor pollicis brevis muscle is a dual nerve supply muscle, and it supplies the opponent pollicis. So these three muscles are the thenar muscles which form the thenar eminence. It also supplies the first and second lumbricals and give sensory branches or the cutaneous branches to the lateral 3.5 digits. So when the median nerve is injured, the median nerve can get injured anywhere along its course. So the effects of the lesion are represented as the ape thumb deformity or simian's hand. Wasting of the thenar eminence is seen, and there is a loss of abduction of the thumb. There is loss of opposition of the thumb. There is a condition called as pointing index finger, and there is loss of sensation over the palmar aspect as well as on the dorsal aspect of the lateral 3.5 digits. So we will see about these deformities in detail in the applied aspect of the median nerve. Have a great day.